Allergies are among the most common chronic conditions worldwide. Allergy symptoms range from making you miserable from a simple runny nose to putting you at risk for life-threatening reactions like anaphylactic shock. According to the leading experts in allergy, an allergic reaction begins in the immune system. Our immune system protects us from invading organisms that can cause illness. If you have an allergy, your immune system mistakes an otherwise harmless substance as an invader. This substance is called an allergen. The immune system overreacts to the allergen by producing immunoglobulin E, antibodies. These antibodies travel to cells that release histamine and other chemicals, causing an allergic reaction. The immune system normally protects an individual against harmful substances such as bacteria, viruses, toxins and even cancer cells. The first exposure to one of these harmful substances, antigens, results in the production of antibodies. They then trigger the immune system to recognize the antigen and destroy it on future occasions. This is an antigen-antibody reaction. In an allergic response, a reaction similar to normal response occurs. A person is exposed to an allergen, antigen, such as pollen. There is a wave of antibody production. Cells in the tissue, known as mast cells, are activated and release histamine. Histamine causes an inflammatory response that leads to the allergic symptoms. More often than not, there is no obvious cause for abnormal allergic reactions to a particular substance. However, some people develop allergies to a wide range of conditions. This condition known as atopy is probably inherited. Along with specific allergies, atopic people may suffer from asthma and/or eczema. Allergy symptoms. An allergic reaction typically triggers symptoms in the nose, lungs, throat, sinuses, ears, lining of the stomach or on the skin. For some people, allergies can also trigger symptoms of asthma. In the most serious cases, a life-threatening reaction called anaphylaxis can occur. A number of different allergens are responsible for allergic reactions. The most common include grass and tree pollen. An allergy to these is known as hay fever, allergic rhinitis. Animal dander, tiny flakes of skin or hair. Food, particularly nuts, fruit, shellfish, eggs and cow's milk. Insect bites and stings. Medicines, including ibuprofen, aspirin and certain antibiotics. Latex, used to make some gloves and condoms. Mold, these can release small particles into the air that you can breathe in. Household chemicals, including those in detergents and hair dyes. Most of these allergens are generally harmless to people who are not allergic to them. Allergies are very common. They're thought to affect more than 1 in 4 people in the UK at some point in their lives. They're particularly common in children. Some allergies go away as a child gets older, although many are lifelong. Adults can develop allergies to things they were not previously allergic to. Having an allergy can be a nuisance and affect your everyday activities, but most allergic reactions are mild and can be largely kept under control. Severe reactions can occasionally occur, but these are uncommon. Allergic reactions usually happen quickly within a few minutes of exposure to an allergen. They can cause sneezing, a runny or blocked nose, red, itchy, watery eyes, wheezing and coughing, a red, itchy rash, worsening of asthma or eczema symptoms. Most allergic reactions are mild, but occasionally a severe reaction called anaphylaxis or anaphylactic shock can occur. Anaphylaxis or anaphylactic shock can be life-threatening. This affects the whole body and usually develops within minutes of exposure to something you're allergic to. Signs of anaphylaxis include any of the symptoms above, as well as swelling of the throat and mouth, difficulty breathing, lightheadedness, confusion, blue skin or lips, collapsing and losing consciousness. This is a medical emergency and needs urgent treatment. Is it an allergy, sensitivity or intolerance? A reaction produced by the body's immune system when exposed to a normally harmless substance. Sensitivity. the exaggeration of the normal effects of a substance. For example, the caffeine in a cup of coffee may cause extreme symptoms, such as palpitations and trembling. Intolerance. Where a substance causes unpleasant symptoms, such as diarrhea, but does not involve the immune system. People with intolerance to certain foods can typically eat a small amount without having any problems. What causes allergies? Allergies occur when the body's immune system reacts to a particular substance as though it's harmful. It's not clear why this happens, but most people affected have a family history of allergies or of closely related conditions, such as asthma or eczema. The number of people with allergies is increasing every year. The reasons for this are not understood, but one of the main theories is it's the result of living in a cleaner, germ-free environment. Cleaner environment reduces the number of germs our immune system has to deal with. It's thought this may cause it to overreact when it comes into contact with harmless substances. What are the types of allergies and how are they treated? You can be allergic to a wide variety of substances, including pollen, animal dander, mold and dust mites. Seasonal allergic rhinitis, or hay fever, is an allergic response to pollen. It causes inflammation and swelling of the lining of your nose and of the protective tissue of your eyes, conjunctiva. Symptoms include sneezing, congestion, feeling stuffy, and itchy, watery eyes, nose and mouth. Treatment options include over-the-counter and prescription oral antihistamines, anti-leukotrienes, nasal steroids, nasal antihistamines, and nasal cromolyn. In some people, allergic asthma symptoms, wheezing, shortness of breath, coughing, and/or chest tightness, can be caused by exposure to pollen. Your symptoms can be reduced by avoiding pollen. Stay indoors when pollen counts are high, close your windows, and use air conditioning. Ask your healthcare provider about immunotherapy, allergy shots, to treat pollen allergy. Dust mites are tiny organisms that live in dust and in the fibers of household objects, such as pillows, mattresses, carpet, and upholstery. Dust mites grow in warm, humid areas. The symptoms of dust mite allergy are similar to those of pollen allergy. To help manage dust mite allergies, try using dust mite encasements, airtight plastic or polyurethane covers, over pillows, mattresses, and box springs. Also, remove carpet, or vacuum frequently with a high-efficiency filter vacuum cleaner. Treatment may include medications to control your nasal/eye and chest symptoms. Immunotherapy may be recommended if your symptoms are not adequately controlled with avoidance methods and medications. Molds are tiny fungi, like penicillium, with spores that float in the air like pollen. Mold is a common trigger for allergies. Mold. Mold can be found indoors in damp areas, such as the basement, kitchen, or bathroom, as well as outdoors in grass, leaf piles, hay, mulch or under mushrooms. Mold spores reach a peak during hot, humid weather. Treatment may include medications to control your nasal or eye and chest symptoms. Immunotherapy may be recommended if your symptoms are not adequately controlled with avoidance and medications. Animal dander. Allergic reactions can be caused by the proteins secreted by sweat glands in an animal's skin, which are shed in dander, and by the proteins in an animal's saliva. Avoidance measures don't work as well as simply removing the pet from your home. Second best measures include keeping your pet out of your bedroom, using air cleaners with HEPA filtration and washing your pet, cat or dog, frequently. Treatment may include medications to control your nasal or eye and chest symptoms. Immunotherapy may be recommended if your symptoms are not adequately controlled with avoidance methods and medications. Some people develop a latex allergy after repeated contact with latex. Rubber gloves, such as those used in surgery or home cleaning, are a major source for causing this type of reaction. Skin rash, hives, eye tearing and irritation, wheezing and itching of the skin may occur if you have a latex allergy. Allergic reactions to latex can be mild, such as skin redness and itching. More severe reactions can occur if your mucosal membranes are exposed, such as during an operation or a dental or gynecologic exam. Treatment of latex reactions begins by removing the offending latex product. If you have latex allergy, it is important for you to wear a medical alert bracelet and carry an emergency epinephrine kit. All procedures should be carried out in a latex-safe fashion. There is no cure for latex allergy, so the best treatment for this condition is prevention and avoidance. Certain foods. Food allergies develop when your body develops a specific antibody to a specific food. An allergic reaction occurs within minutes of eating the food, and symptoms can be severe. In adults, the most common food allergies are shellfish, peanuts and tree nuts. In children, they include milk, egg, soy, wheat, shellfish, peanuts and tree nuts. If you have a food allergy, your symptoms include itching, hives, nausea, vomiting, diarrhea, breathing difficulties and swelling around your mouth. It is extremely important to avoid the foods that cause allergy symptoms. If you, or your child, have a food allergy, your doctor may prescribe injectable epinephrine, adrenaline, for you to carry at all times. This is needed in case you accidentally eat foods that cause allergies. There are new therapies for peanut allergies called oral immunotherapy. Insect venom, stings. Bee sting. If you get a bee sting, a normal reaction includes pain, swelling and redness around the sting site. A large, local reaction includes swelling that extends beyond the sting site. For example, if you are stung on the ankle, you may see swelling in your leg. The most serious reaction to an insect sting is an allergic one, which needs immediate medical attention. Symptoms of an allergic reaction to an insect sting include difficulty breathing, generalized, widespread hives that appear as a red, itchy rash that spreads to areas other than the area that was stung, swelling of your face, throat or mouth tissue, wheezing or difficulty swallowing, restlessness and anxiety, rapid pulse, dizziness or a sharp drop in your blood pressure. If you have a reaction like this, a resting can cause a serious reaction that can be life-threatening. An allergic reaction is treated with epinephrine, adrenaline. If you've had an allergic reaction to bee stings, see a board-certified allergy or immunologist to get a scan and/or blood test to confirm your allergy to bee venom. Venom immunotherapy is recommended if venom allergy is confirmed. This will help reduce the possibility that a resting will cause a serious reaction. What is allergic rhinitis? Nasal allergy symptoms and hay fever are referred to as allergic rhinitis. Seasonal allergic rhinitis is nasal allergies that change with the seasons because of pollen from plants, trees, grasses, or weeds. Seasonal symptoms arise during the pollinating seasons for particular plants. Because you can be allergic to more than one thing, your symptoms may get worse at different times throughout the year, or may be constant. Does everyone get allergies? No. Most allergies are inherited, which means they are passed on to children by their parents. People inherit a tendency to be allergic, although not to any specific allergen. If your child develops an allergy, it is very likely that you or your partner has allergies. How common are allergies? More than 50 million Americans, 1 in 6, experience all types of allergies, including indoor or outdoor allergies, food and drug, latex, insect, skin and eye allergies. The number of people who have allergies continues to increase across all ages, sex and racial groups. Risk factors. You might be more likely to develop an allergy if you have a family history of asthma or allergies, such as hay fever, hives or eczema. Are a child. Have asthma or another allergic condition. Complications of allergy. Having an allergy increases your risk of certain other medical problems, including anaphylaxis. If you have severe allergies, you're at increased risk of this serious allergy-induced reaction. Foods, medications and insect stings are the most common triggers of anaphylaxis. Asthma. If you have an allergy, you're more likely to have asthma, an immune system reaction that affects the airways and breathing. In many cases, asthma is triggered by exposure to an allergen in the environment, allergy-induced asthma. Sinusitis and infections of the ears or lungs. Your risk of getting these conditions is higher if you have hay fever or asthma. Prevention of allergy. Preventing allergic reactions depends on the type of allergy you have. General measures include the following. Avoid known triggers. Even if you're treating your allergy symptoms, try to avoid triggers. If, for instance, you're allergic to pollen, stay inside with windows and doors closed when pollen is high. If you're allergic to dust mites, dust and vacuum and wash bedding often. Keep a diary. When trying to identify what causes or worsens your allergic symptoms, track your activities and what you eat, when symptoms occur and what seems to help. This may help you and your doctor identify triggers. Diagnosis of allergy. If a person believes that they may have an allergy, their doctor will be able to help them identify what is causing the reaction. The person should be ready to explain any symptoms they have noticed, when and how often they occur, what seems to cause them, any family history of allergies, whether or not other household members have a similar reaction. The doctor may recommend some tests or refer the person to a specialist. Tests for allergy. Below are some examples of allergy tests. Blood tests. These measure the levels of IgA antibodies to specific allergens in the immune system. Skin prick tests. A doctor will prick the skin with a small amount of a possible allergen. If the skin reacts and becomes itchy, red, or swollen, the person may have an allergy. Patch tests. To check for contact eczema, a doctor may tape a metal disc with a small amount of a suspected allergen to the person's back. They will check for a skin reaction 48 hours later, and then again after 2 days. Treatment of allergy. The best way to manage an allergy is to avoid the allergen, but this is not always possible. In these cases, medical treatment can help. Medications for allergy. Drugs will not cure an allergy, but they can help a person manage the symptoms of a reaction. Many treatments are available over the counter. Before using a medication, however, a person should speak to a pharmacist or doctor. Options include anti-histamines. These block the action of histamine, which the immune system releases during a reaction. Decongestants. These can help relieve a blocked nose. Corticosteroids. These are available in the form of a pill, cream, nasal spray, or inhaler. They help reduce inflammation. Immunotherapy. This can help a person develop long-term tolerance. A person will take gradually increasing doses of the allergen, either as a tablet or an injection. Leukotriene receptor antagonists, anti-leukotrienes. These may help with some allergies if other treatments have not worked. The drugs block some of the chemicals that cause swelling.